Good morning, everybody. It's Dr. Galvin with another update. Today we're not going to talk about COVID, though. We're going to talk about monkeypox. I've gotten a lot of questions about monkeypox. People are worried about monkeypox. You shouldn't be, and I'm going to tell you why. First of all, I'm Dr. Galvin. I'm a board-certified emergency medicine physician. I'm also a functional medicine, precision medicine physician. I have a clinic in Charlotte. Been doing updates about COVID throughout this pandemic. But today we're not talking about COVID. I did work in the ER last night. Not so busy last night, knock on wood. We are still seeing COVID, although really not seeing a lot of sick people with COVID. Most of the COVID cases we're seeing are very, very mild because so many people have been immunized and infected, so they're pretty protected. We're not seeing tons of COVID admissions. So that's it for COVID. Let's talk about monkeypox. What is it? Monkeypox is a relative of the smallpox virus. Right now in the U.S., as of this morning, there are 9 confirmed cases in the U.S. and worldwide, there are about 400 confirmed cases. It is a virus that is transmitted primarily by direct contact, although you can, if you have very, very close proximity for somebody for a long time, there is some aerial transmission, but basically it's transmitted by infected lesions. And what happens is, these lesions sort of form and then they open up and they're filled with virus. And if you get exposed to those, or you get exposed to somebody that has it, maybe their clothing, or if you share a bed with that person, you can get exposed yourself. We have a test for it. It tests for something called the orthopox virus, which is again in that same family of smallpox. Now remember, smallpox was the very first disease that was eliminated completely by vaccination, and smallpox killed lots and lots of people before. But we still maintain stocks of smallpox vaccine because it's one of those things that people are worried about in terms of biological warfare and things like that. And since there is no more smallpox, none of us have any immunity to it either. What would you expect if you were to come in contact with it? Well, the incubation period is about 5 to 13 days, although it could be up to 21 days. And when you start having symptoms, it's flu-like symptoms, myalgias, body aches, fever, things like that. And then you start developing these sort of flat-looking lesions on the arms and on the face. What we're seeing largely now are a lot of genital lesions because it looks like most of the current cases are being spread from sexual contact. Then those lesions sort of fill up with fluid, which is loaded with virus, and then they burst and they scab over, and eventually they go away. While you have the lesions, you're contagious. It's generally self-limited. People will get sick with it, and within about 2 weeks or so, they're through it, and most people do not have any major problems with it. Let's see here. Again, lasts from 2 to 4 weeks total, and resolves, like I said, typically with no problems at all. Transmission is primarily skin to skin, but again, if you get exposed to that juice inside of those things, if you share clothing with somebody or share bed sheets, you can get exposed that way. Tiny, tiny chance of getting it spread airborne. Treatment, not any specific treatment. Like I said, most people it's going to resolve on its own. There are, though, 2 antiviral therapies against smallpox that presumably will work against monkeypox as well if the need arose. We have 2 vaccines for this. There is an older vaccine that is a live replicating virus vaccine, kind of an old traditional vaccine that's effective, but there's a little downside. About 1 to 2 people out of every million that get that vaccine have a potential to die from it. So it's a tiny, tiny percentage, but it's there. We have, I think, 100 million doses of that vaccine stockpiled in the U.S. because, again, if there was a biologic attack with smallpox, we would have those stores on hand. Now, in 2019, a new vaccine was developed against both monkeypox and smallpox that is a live, non-replicating viral vaccine that's more effective and safer. And we have about 1,000 doses of that in the U.S., and I think they're probably ordering more. The controlling of this is basically identifying cases, isolating them, and tracking contacts. I alluded to kind of sexual transmission. It looks like the primary cases so far have been related to homosexuals, and there were some events in Europe that people seem to have been come in contact with it, and it seems like, at least initially, it was primarily transmitted sexually. The problem is these lesions are contagious, so a condom and things like that are not really going to help prevent that. So the idea is identify who's got it, isolate those people, and track their contacts and make sure that they don't spread it out. Again, tiny numbers. I don't think this is going to be a big problem, but I got a lot of questions, so I'm trying to give you the up-to-date information. I'm Dr. Galvin. If you like this, please subscribe. If you've got questions, throw them in the bottom and I'll try to answer them. Have a great morning. See ya.